I'm Dr. Amee Shah, and I'm here with a reporter, Loukia Taylor. We are going to have a conversation about all things communication and accents. So listen in because this might be very relevant to you if you are looking for improving your communication or leveraging your communication for your organization, or if you are a clinician looking to manage accents and dialects and communication with your clients. So I am going to be talking about important tools, strategies, and even questions that the public have all the time. And so this will be very robust, very handy, and you can ask your own questions in the chat. So stay tuned.
So, Dr. Shaw, you've described situations in which there are two people in a conversation trying to communicate, but they're having trouble understanding each other due to language and linguistic barriers. What's the solution to such a problem?
So yes, we have. So I'll give a specific example. For if you go to a doctor, and the doctor is say from India or China, and this is very common. So they are talking at you, not to you, pretty fast, and you walk out of there with your head spinning. So yeah, it's not a great situation for the patients and for the doctors because they never know if their work landed with the patient or not, and the patient is confused, and that's a big safety issue. So, yes, we do have solutions for this. It's called accent management, and it also falls under cross cultural communication. And it's what speech language pathologists are equipped to help with. There are a lot of non-licensed people, but that's where the public needs to be aware that you don't want to just go to anyone to fix your accent because they can do a lot of harm. We want to go to professionals, ESL teachers, English as second language teachers. They work on pronunciation as well as clinicians because the idea is not to change the accent or change the whole identity of a person, but to show them where their accent or their communication doesn't even have to be accent, their communication is not landing with the person, where they're losing them. Is it vocabulary? Is it grammar? Is it the pronunciation? Is it the pace? And so they are trained to know what's working for them, what's not working, and then to leverage the communication for best results.
So, Dr. Shaw, in American society, it can be seen as sort of impolite to point out sensitive topics such as someone's accent. So, how do you broach this sort of topic?
So I have had referrals from, say, managers of a department, and they do the annual review. Let's say they work in sales department, and they know that customer service complaints have come in, or they're losing sales, or a doctor who is getting bad poor ratings from their patients, and the hospital is losing reimbursement dollars from insurance because of that, and also it's a safety issue. We offer this not as a correction, but as an enhancement. It's a communication enhancement. So, like, whenever anybody is moving to a different country, there are a lot of things. I myself am an immigrant. I've had to learn a lot of the ways of this world, right? So we learn how to talk and how to dress and how to, like do have different etiquette. So communication is the same thing. It's just that no one teaches you if you're not in that world. And so in a short amount of time, if you can get an expert to say, these are the things that are working for you, these are the things that need tweaks, then why wouldn't you want to get your communication enhanced, right? So that's the idea. It's broached as communication enhancement. Then it's also done in very respectful ways, offering this as a service. We have a screener that identifies that, hey, have you noticed these situations? Do you feel like you want to connect with your clients and you're feeling like something's in the way and you're not able to reach them, or if you feel like people are not respecting you, um, or they don't get you, then do you want to do something about this? And here is a coach who can help you with that. So that's how they have communicated, and people have been very receptive. They've been we have long waiting lists because people want to get on this. If the organization is offering the service, they want to sign up, and as soon as they sign up and they hear what it's about, and we also do the screening and diagnostics, they actually enjoy it so much because they are like, oh wow, that's how my language works, and that's what I've been doing. That's I didn't know that you could speak that word in this way, or that sound is different in my language. So it becomes a conversation that they don't normally get a chance to talk about. So it's been very fun, very fascinating, and they've all had amazing feedback. Um, so yeah, so it's not been a difficult conversation, but yes, for the managers sometimes they wonder like, should I mention this or not? That's where we empower them with the tools that that helps them have this conversation.
I like that you
Yeah.
empower them with
Yes.
tools.
Yeah.
Can you tell me a little more about those tools and
Uh-huh.
why these clients seek you out particularly?
Okay. Well, as I mentioned, we have the screening. There's two types of screening. There is the sort of the checklist, where have you seen these problems, and so that there's a score that goes with that. So if you meet a certain benchmark, and you're below that benchmark, then it's not so much a bias, a subjective decision, um, because it can be misapplied in the wrong hands. Someone who doesn't like you may say, I don't think you speak clearly, and you shouldn't be here. But if the benchmark says, okay, you're checking off on all these things, what are the metrics saying? And then we have a communication screener that actually identifies with the sounds, with the words that they say, how thick their accent is or what's in the way. Then with those two things, they can immediately know that their scores are saying they need work, and not changing everything about them, just those aspects of communication that are interfering, that are causing, confusion. So just becoming aware that these were the things that have been in my way, and here's a screener. Then we have a very powerful diagnostic tool. It's called the CAI, CAAI. And you'll see that in the captions. And the tool helps cast a wide net, looks at 22 different areas of communication, everything verbal, nonverbal, grammar, social communication, tone, idioms, and the stress and rhythm and tone, as well as the consonants and vowels. So, like looking at all of this, what is truly getting in the way of your communication based on your own unique language? If you're a Russian speaker or Japanese or Chinese or Indian, uh, all those languages, the fact that they're different from English, there is interference. So we capture those, then we create a diagnostic profile that has the strengths, not just the weaknesses, but the strengths, and then the areas that can be improved, all with scores. So that's our diagnostic profile. And then we have a robust communication coaching program that I mentioned, that is with the best practices that I've created in the field, that have been awarded, with national recognition for this. So these are the credentialed things that are set apart from the thousands of tools that are available out there that are leading people astray. That they're spending their money worse. They get demoralized. They think something's wrong with them. They come out of this training feeling more broken, and are being sold more and more tools and techniques. That is something I don't advocate, don't endorse. And so, if tools can identify, here is the problem, and here are your strengths, so you can speak to the strengths, and here's, in three hours or 5 hours, we can get you strong, clear, and walk out of here. Then that's what I want them to do, not stay in this never ending cycle, and stay empowered, so they can uh, lead with their strengths, and when they need to change and tweak their communication, they know exactly what they need to tweak.
Um, I would invite you to expand more on that, how your offerings differentiate from AI.
Yeah, absolutely. Because these are gimmicks, right? Like how many, all these language learning programs, how many times you've played, what is the one that,
Duolingo.
Duolingo, right? So you spend hours on that. How much have you really grown?
Mm,
And it's the same stuff that, so it's not custom tailored. That's the difference. I work with clients, in 1 hour, we do their face to face, their diagnostic assessment. And when I say face to face, it's also on Zoom if they're wherever in the world. And so we're listening to them. We have this whole norms based, standardized assessment to look at truly what is in the way. And then we have a diagnostic profile that creates the pathway of what we're going to work on. Then we have scores to constantly see, are they improving on this? What needs to be tweaked? It's a personalized coaching. And then they have measurable results. Not only what we say, but we also have their bosses evaluate, their patients evaluate, and the test itself evaluate. So this is very outcomes based approach that's custom tailored. That is not what AI can do. And it's a very humane approach because we are empowering people about how they feel about themselves to have power in situations where they don't have any control. If someone is talking down to them, how can they stand up and represent themselves? So that's what I'm passionate about, because when people come from a different country and language is a barrier, they often have a low opinion about themselves that people just make it worse. And so that's where I'm I put my career on this, and also training students and clinicians to have the same ethic, where we want our client to represent themselves. They don't need to rely on us as the crutch for the rest of their lives, or and they don't need to be um, shortchanged with gimmicky approaches and shortcuts. There are no shortcuts. If you want to learn a language or if you want to change your communication, you need to know you and then work from there.
hmm.
Yeah.
So, with all of these offerings and this knowledge that you're sharing with people, how can a manager or an employer uh, start to bring up this topic with their employee
Mhm.
in order to help them utilize your services?
Yeah, so the manager can certainly contact me. They can. I would give them that. It's a little bit of coaching. So to give them the tools that I said, they can use. It has a checklist, and then they have. They could do a screener, and then they would offer it to their employee as a communication enhancement. If the employee is willing, then they just sign up. A very important second component to this is the listening piece. So all this time we've been talking about sort of helping the person with the strong accent or communication gaps, but I'm also all about changing the culture of the person, of the environment around that person, because no matter um, how much we enhance a person's communication, if the people are continuing to listen to them in the same old ways, um, like I had a person with a strong sort of, she was a woman in a very prestigious institute. She was top of her game, but so she was very good with her communication. She had grown, but her boss continued to still listen to her in the broken way. So so that's where cultures need to be changed. So I've developed a listening training program, which is leading in the field. It is going to be part of the centennial session this year in the American Speech and Language Hearing Association conference. And the idea is that we can train people how to listen differently, how to listen to accents in a fun, game based way, so that it's a low stakes. And whether it's a 17-year-old student or a 80-year-old veteran who says, I can't understand people, everyone has been impacted by the training. Everyone can learn, because the program is helping them be relaxed, listen, and recognize accents, and then that helps them appreciate diversity, appreciate differences, and recognize that actually I'm enjoying talking to people who sound different because now I have skills to understand what they're saying. So that's what the program is doing. It's a foreign accent perception and sensitivity training program, FAPST. I know it's a mouthful, but that's very unique. There's nothing else out there like that, and I'm hoping that more people start to do more listening trainings in different ways. They don't have to go with FAPST, but we have published on this, and we've seen that the brain actually rewires, and the listening can retune in a short amount of time as people reduce their unconscious bias and learn to appreciate accents and people with accents. Yeah,
What a beautiful, beautiful mission indeed.
thank you,
It has been such an honor learning more from you, and I'm looking forward to seeing the future of your tools.
thank you. Yeah.